Ladies and gentlemen, let me begin by welcoming all of you here today and tell you how exciting I think it is that someone of John Mendelsohn's stature and accomplishments has agreed to become a senior fellow here at the Baker Institute upon his retirement as president of MD Anderson. I am, of course, pleased from a professional point of view because of John's outstanding reputation and qualifications, but I am also personally pleased because he and Ann and Susan and I have enjoyed a friendship for the full time that the Mendelsohns have been here in Houston. I'm equally as excited, of course, that Ellie and Jenny Simmons have endowed this position. An extraordinarily generous gesture on their part that makes it possible for John and the Institute to come together in this way. You will hear from both John and Ellie in a moment, as well as David Liebran, the president of Rice University. But first, I want to turn this mic over to the founding director of the Baker Institute, Ambassador Ed DeRiggio. Ed?
Thank you very much, Secretary Baker. Our presentation today is being webcast on the internet simultaneously, so be careful what you say. We are truly honored and delighted that Dr. John Mendelsohn will be the first person to hold the position of the Ellie and Virginia Simmons Senior Fellow in Health and Technology Policy. Dr. Mendelsohn's appointment will enhance the Baker Institute's Health Economics program by bringing together an internationally recognized leader and renowned practitioner in the medical field with top policy researchers shaping the public debate on healthcare choices and costs. As a Baker Institute Senior Fellow, Dr. Mendelsohn will begin his work here in March of 2012. He will collaborate with scholars across Rice University and the Texas Medical Center. He will identify and evaluate discoveries of new technologies, therapeutics, and best practices, as well as promote policy recommendations to improve health outcomes both locally and globally. Dr. Mendelsohn's groundbreaking work on personalized care will give us the unique opportunity to explore policy questions that we haven't been able to address so far at the Baker Institute. Because Dr. Mendelsohn understands so well the practice of medicine and health policy, he will be invaluable in helping us determine the right questions to investigate now in order to determine how best to disseminate genetically tailored treatments in the future. If we can get ahead of new technologies before they make it to the marketplace, we can make better policy recommendations for targeting treatments to those who will benefit most, and equally important, while avoiding waste in the system. With Dr. Mendelsohn's expertise, we will broaden our knowledge of how technology improves healthcare while seeking to slow cost growth. Also, by joining the Baker Institute's Health Economics program, Dr. Mendelsohn will contribute to our leading public policy forum here for the study of health economics. Dr. Vivian Ho, who's with us, the James A. Baker III Institute Chair in Health Economics, has a leading role in studying the effects of market competition and regulation on patient mortality rates, hospital costs, and the prices that patients and insurers face for cancer surgery and cardiac care. As a Baker Institute Fellow, Dr. Ho works closely with researchers in the Texas Medical Center, where she is also a professor at Baylor College of Medicine. With John's appointment, we are broadening our outreach and collaboration with the Texas Medical Center, and we are building toward our goal of addressing national and global health policy issues. So, Francoise and I and the whole Baker Institute fellows and staff welcome you, John and Ann, to the Baker Institute and to the Rice community. We couldn't be happier. I am also especially delighted to express our deep appreciation for the generosity of Ellie and Ginny Simmons, whose gift, which endowed this new position, will allow the Baker Institute to deepen and expand its health economics program and policy research. Ginny and Ellie epitomize, in our view, the very best in philanthropy, and we are honored by their participation and their support of the Baker Institute's programs and of Rice University. Ellie, we'd be delighted if you would come and say a few words.
Thank you, Ed. And it's such a treat for our family to be associated with such an outstanding institution and such wonderful people. Honestly, I look at the group here, and I think there is no group that I would rather see my kids emulate in terms of their lives than the service that particularly the four of you, Secretary Baker, Ambassador Durigian, President Liebren, and Dr. Mendelsohn. You've given a life to service. You've shown us that that you can sacrifice a lot of the fine things in life and be rewarded by serving millions. And I think that's a message that's really important, and we are very happy to support that. And I also think that healthcare is the issue for the next 10 or 20 or 30 years until we get it right. And I think Rice, and I think particularly the Baker Institute, are extremely well positioned to really lead the discussion on a practical way, and on a way that is going to get this country addressing the issue in the right way, and in a way that will really help our economy and help the people of the country. And I can't tell you how proud we are to be associated with you, and how much we appreciate the work you've done and the example you've set.
Thank you very much, Ellie. Jenny. It's now my pleasure to invite the President of Rice University, David Liebren, to the podium.
Well, I'd just like to really add my voice on behalf of the university to some of what's already been said. First, perhaps as much on a personal as a professional note, John and Ann Mendelsohn have really been the role models for Ping and myself since we arrived here in Houston. There are really no better citizens of this city. What you have done professionally across multiple dimensions in the city, the way you have really embraced the city and the city has embraced you, the way you have contributed to the advancement of the city very broadly has been an inspiration really to all of us in the city, and most especially to those in the nonprofit sector. So it is really an honor for Rice to welcome both of you, and particularly John, becoming, at least in some sense today, a Rice Owl. And we will make sure you have all the appropriate insignia to support that recognition. This is an important moment, we think, for a variety of reasons. We think it's important for the nation. As you've heard, there aren't really more fundamental problems that we face than the healthcare problem in our country. And whatever side of the debate you're on, I think everybody acknowledges there is a challenge there to be solved. And it's going to take a lot of work. And neither technology alone is going to solve that problem, nor policy alone is going to solve that problem. And that's why this position is so important, and why we're so grateful to have John with us, because it's at the intersection of technology and policy, and making sure that we get those choices right, and encouraging the technologies and using technologies, disseminating technologies. This is where the Baker Institute can really make a distinctive contribution to our country. And we're very proud of the Baker Institute's record in doing that across a range of fields. And this strengthening of the Baker Institute's position in health policy is a great step forward, not only for the university, but I think also for our country. This also sits at the intersection of Rice and the Texas Medical Center. That has been a central part of our strategy as a university. The Baker Institute has been a key element of that strategy, and this will strengthen its role as part of our engagement with the Texas Medical Center. We're delighted, as the world should be delighted, that Dr. Mendelsohn is carrying on his research at the MD Anderson Center. That has been a remarkable contribution to our scientific knowledge, to building the premier cancer research institute and hospital in our country, to bring that experience, that expertise together with the efforts of the Baker Institute, I think is a real moment in our history, a moment for the Baker Institute, but I think a very important moment for Rice University. And I'd like to express my appreciation not only to Dr. Mendelsohn, but to Ambassador Jirijian and Secretary Baker for your leadership, as always, in driving the Baker Institute forward, making it a part of the solution to national problems and an integral part of what Rice University is trying to contribute. So thank you so very much for that. And then finally, I really do want to thank Ellie and Ginny Simmons for what is really a visionary gift from my point of view that really stands, again, at the intersection of the core endeavors of this university and our vision and strategy. And it would be enough if you were just doing this, but this is actually the second time you have done this, and really built that bridge between Rice University and the Texas Medical Center to assure that these institutions pursue fundamental goals, not alone, not in silos, but in collaboration, bringing together our respective strengths. And Dr. Mendelsohn is such a remarkable addition to that. And so we thank you really for your visionary philanthropy for the second time in enhancing that collaborative endeavor. So again, on behalf of the university, I just want to say we think this is a great moment forward. We couldn't imagine being associated with somebody of greater distinction than John Mendelsohn, and we anxiously look forward to the important contributions this effort is going to make.
Thank you very much, David. And now it's my pleasure to invite to the podium Dr. John Mendelsohn, but before I do that, I have to say one thing. He is following in the footsteps, this is rare, of his grandchild, Jonah. Jonah was a Baker Institute intern. I think he wasn't over 15 years old when he started working here. I think I'm going to be litigated for child labor or something. But he turned out to be one of the most brilliant interns we had here. He did serious research. So this is an incredible moment where the grandfather is, you know, succeeding in the steps of Anne and John's grandson. So if the grandfather of Jonah can come up, I'd like to.
That's great, Ed. Thank you. Well, what a wonderful day for me. It's a great honor to be a senior fellow at the Baker Institute and to stand before you with, Ann and I have been Houstonians for 15 years, and we consider ourselves lifelong Houstonians. And it's a special pleasure to be here with some, you can't say old friends, you don't say that anymore, some long-standing friends, the Bakers and the Barnetts, and more recently the Jirijians, and now, I'm sorry, more recently the Lebruns, and now, much more recently, the Simmons, who I also want to add thanks to. You know, it takes funds to do research. And when I accepted this appointment, I didn't know we'd have a budget. And you've made it possible now for us to do some more imaginative things. So it's very much appreciated. I've always wanted to be at a real university after I left UCSD, where I started their cancer center and helped start their medical school. And I've been at Sloan Kettering, which is very focused on cancer. And I've been at MD Anderson, which is very focused on cancer. And it's worked. We've gotten a lot done, and I'm not leaving MD Anderson. I'm going to continue our research. But it is very exciting for me to think that I'll be back at a university that is a complete institution of learning, examining public policy and economics and history, and even literature. I have some secret plans in that direction. So, and Rice is a very special part of our lives, and this is tremendously enriching that for us. I'm going to be taking a sabbatical for 6 months at my alma mater, Harvard, to commit myself in the area of full-time research in the area of genome-targeted therapy, which is something that not only requires science, but it requires public policy. As we learn our genomes, there are tremendous questions that are ethical and that are policy questions about what to do with the information we have. How does it affect our lives? How do we build it into our healthcare system? It will add expenses, but it will also add benefits in terms of longer life and better treatments. And this is an area that I will be looking into not only with the microscope in the laboratory, but also in the area of public policy, and I'm looking forward to that. But equally important in public policy is health care. And I've spent a fair amount of time thinking about that and working on that, even in my role as president of MD Anderson. I'm often asked, how are we going to reduce deaths from cancer? And I say about half of it is going to be more research, understanding the genes that cause cancer, smarter doctors, better treatments. And the other half has to do with the population of the United States and their lifestyle. 50% of the reduction in deaths that we could achieve in the next decade are changes in behavior and lifestyle that have nothing to do with what goes on at MD Anderson. If we all quit smoking, about 30% of cancer deaths would disappear. If we are trim instead of overweight, in this country about a quarter of the country is obese now, very clear correlation between obesity and cancer, heart disease, hypertension, and diabetes, and you add all of those up, and that's about 50% of hospital admissions. So this is a huge area that I think needs a lot more attention from the point of view of public policy. It's partly an education question. It's partly an accountability question. What is the fair thing to do with someone that is overweight and smokes in terms of the costs of their insurance, taxes? What's a fair price for a cigarette? Should it cost the same as a cup of Starbucks coffee? They both last about the same amount of time in your hand, and cigarettes are a lot cheaper. So these are kinds of issues that I'm very interested in. I know Vivian Ho's interested in. And then you get to the broader area of public policy. We're changing how medical care is going to be delivered in this country for two reasons. One is we're spending too much money on it. It's 17.5% of the GDP. And the other is that our Congress and President have signed into law a new health care initiative, which is going to add 25 million people to the insurance rolls, paid, where the care is being paid for at less than the cost of delivering the care. We're going to have to deal with that. We're already dealing with that in the area of Medicaid and Medicare, where the reimbursement is not enough to cover costs. And as you know, many doctors don't accept Medicare patients. These are huge issues that need the attention of an institution like the Baker Institute at Rice. What's fair? What is something that we can get agreement upon with the American people, and then bring that to the attention of the people that pass the laws and sign the laws? So I'm excited about working in those two areas, the area of genetic information and the area of healthcare delivery. And the third area that I'm interested in working on is biotechnology in Houston. Now, Houston, Greater Houston, which extends from College Station to Galveston, has some terrific academic institutions. Together, the research budget is over $1.5 billion. Ann and I lived in San Diego. San Diego research budget in their academic institutions and private research institutions is about $1.5 billion. But there's one big difference. San Diego also has a sector of biotechnology, a commercial sector, which has a research budget equal to that. It's about $1.5 billion. And in Houston, we do have some biotechnology, but the amount of money expended in the private sector in biotechnology is very small. And yet we have the largest and probably the best medical center in the world right here in Houston. It's something that I feel we have to play catch up on. Most of the biotechnology companies in this country are on the East Coast and the West Coast, and we're late. But we are getting started. I work with BioHouston, and I work with a number of people in the community. We're trying to get the word out and develop the entrepreneurs and the venture capitalist interest in Houston. Rice is working on the same thing, and there are other community organizations working on this. I believe that Houston needs to take biotechnology as a fundamental basis for its economic development over the 21st century, along with the other great things going on here. And if we miss that opportunity, we will have wasted an incredible resource for the community. So this is an area that involves public policy and public interaction with the private sector. It's something that I hope to spend time on, and I think that's enough of a menu to keep me busy in a part-time task working over here at the Baker Institute. So I'm very much looking forward to returning from my sabbatical and beginning to work more closely with our friends and our colleagues at Rice. And again, I want to thank everyone in this room that was involved in making this happen, and especially the Simmons family for the honor of being the first holder of their chair. Thanks very much.
There may be a few questions.
Okay.
You could sit in the middle there, Vivian, if you could come up.
If there are any questions?
Dr. Mendelsohn, how do you plan to use the national and international platform the Baker Institute provides to influence decision makers?
You know, I'm part of a large national and international platform in cancer. And I think that there's two ways to look at this. One is learning best practices. Healthcare delivery is very different. I know a bit about it in England and in France, where there are some things they do better and some things they don't do as well. And I could name other countries. But I think in terms of developing policy at the Baker Institute, we can draw on our friends, invite them to conferences here, national and international. But then we're going to have to, Vivian and I and others locally are going to have to decide on the position papers to take. I hope they're welcomed. I think it's a wonderful platform. Goodness knows if there's anything we need in this country, it's some guidance on how to solve the huge two issues, healthcare and education, if you want to leave out Social Security and what we do with older people. And these are areas that I know the Baker Institute is passionately interested in.
Can I follow up?
Sure.
It's in a little different vein here, but what kind of medical breakthroughs do you expect that we'll be seeing? You mentioned the therapy, but that will have implications for public policy.
Well, the most important breakthrough is going to be in two areas that you might not suspect I'd answer. One is prevention, and I think I hinted at the fact that, in my opinion, half the deaths, if we want in the next decade reduce deaths from cancer with what we know now, half of it is prevention and the policies and education that go along with that. And then I think another huge change that's going to occur is how we deliver health care and pay for it. We're going to have to devise a system where the providers, the doctors and the hospitals, are incentivized to cut costs when they deliver care. And that's not built into the system today for various reasons, and it doesn't work. And we all know it. It's part of the Accountable Care Act that was passed by Congress, but it's not the major emphasis. The major emphasis was ensuring the uninsured people in America, which is very important. But the cost of that is going to add another $1 trillion over the next decade. And we're not going to cut Medicare $500 billion to pay for that, even though that's stated. We've got to find a way to incentivize and build in the systems that give health care more efficiently and at reduced costs. Now, those two areas, I think changes are going to occur in the next decade, because if they don't, we're in trouble. From the point of view of medical science, which is what I've spent most of my life on, I think that there's more and more understanding of the molecular and genetic causes of cancer. And by genetic, I mean caused by gene abnormalities. When I went to school, genetic meant inherited. But genetic disease today doesn't mean inherited. In fact, the biggest gene abnormalities in cancer are caused by the carcinogens in cigarette smoke, which damage the gene as if you had inherited a defective gene, but in this case, it's acquired and therefore preventable. But as we understand cancer more and more, our goal in the new Institute for Personalized Cancer Therapy at MD Anderson, that I'll have the privilege of co-chairing with my colleague Gordon Mills, our goal in the next 5 years is to do the research, taking individual patients' cancers and assessing which genes are abnormal in those cancers. And it's from a list of 200 or 300 possible genes. In any one cancer, there's probably 30 or 40 that are abnormal. There's probably 5 or 6 that are abnormal that are really driving that cancer. Then the drug companies have over 800 now experimental drugs that target the products of those genes. So we'll be able to assign therapy to a patient based on what's wrong in their cancer, rather than all breast cancer patients get one drug and all lung cancer patients get another drug. And that's all research today. It's expensive research. And our goal, our stated goal for the Institute at MD Anderson, Institute of Personalized Cancer Therapy, is that 5 years from now we will have set up the systems and done the research to prove that this is correct, it's better for the patient, that it's cost effective, so it becomes standard of care, so it's paid for by third parties and Medicare, and so we don't have to keep raising philanthropy and trying to find ways to support what is now an important research program. And I think that will happen in the next 10 years. I hope faster.
Vivian, if you could, what Dr. Mendelsohn has just said is so complementary to the health economics program that Vivian Ho has been led. If you just very briefly summarize our health economics program at the Baker Institute.
Oh, sure. Yeah. So we've been doing a lot of research on regulations influencing, for example, cardiac care, studying in which cases states are effective in improving quality of care and in lowering costs, in which cases they aren't. But for example, what Dr. Mendelsohn is talking about, if in terms of genomic medicine, when you look at the top journals in health economics or economics, you actually don't see anyone studying genomic medicine. And that's because health economists are very good at writing equations, regressions, thinking about economics, but we don't know the first thing about genomics. I don't think we could give you your standard health economist couldn't give you a good explanation of the difference between a DNA and a chromosome and a gene. And so this is where Dr. Mendelsohn comes in. Instead of, we've just got piecemeal papers looking at a particular genetic test and whether it's cost effective or not, what we're going to be able to do is get out ahead of these technologies and figure out, well, in which cases are these actually cost saving? How do we sort of incorporate these particular tests as a result of that? How do we incorporate them into the insurance system? Should we be covering these under Medicaid? Should we be covering them under Medicare? And if so, how do we do that and find the best way to sort of disseminate this technology in a way that it improves the lives of as many people as possible, but without breaking the bank on the healthcare system?
Great. Any other questions?
I have one just broad one to somebody else. You mentioned it again. Where do you think the healthcare debate is going? The national healthcare debate. Where are we headed on that?
Am I allowed to defer that to Secretary Baker? He's calling time out.
You've got 5 hours to respond.
Well, the public debate's going nowhere. But I think in private, in Washington and around the country, there are many people seriously studying the question of how to improve the value of healthcare, value in terms of outcomes divided by costs. That's the definition of value in the business school books that I read. And I believe that there are many good proposals on the table. None of them are perfect. And if you want a perfect world, don't go into government, or for matter of fact, don't go into much. So the key issue is when you change, some people are going to have different economic incentives and different incomes, and all the marbles are going to be in different buckets when we get done. And that's very hard to do in a democracy. It's very hard to even do in a dictatorship. So what I think is needed now is some charismatic consensus leaders who can make the point that the world isn't perfect and we're not going to have a perfect system, but the current system is broken in terms of its costs and in terms of caring for about 15% of our population, and that the plans that are in place now only take care of that second problem. And we need to agree to work on the problem of efficiency and cost with the idea of action being taken rather than lots of theories being proposed. And it's going to take some strong leadership that is willing to take the risk and also accept the credit.
Let me suggest that the answer to that question will probably await November 2012.
I hope on December 2012 we start getting some answers. I'm not confident.
Possible, but not absolutely certain that it will. But it will be possible, perhaps.
One last question.
I was interested to hear President Lebron talk about the intersection of technology and policy, which you two represent in many ways. And I was just interested in your description of trying to kind of build the value equation into the health policy debate. Where does the quality of life aspect come in? Technology has allowed us to save very premature infants these days. It allows us to prolong life at the end of the life cycle at great cost. Where do we build in the quality of life considerations?
Well, of course, that's a hugely important question. And it's the basis of the grandma question. And it's the basis of the knowledge we all have that probably over a third of all of the expenses in our own health care are going to be incurred during the last 6 months of our lives. But we don't know when that clock starts at 6 months. In the United States, the atmosphere we live in, the culture we live in says, don't leave any stone unturned. If there's one chance in 100 that there'd be something that would help a patient, let's try it. That isn't the way it is in any other country. They have guidelines and rules, and they have a limited budget. And when you spend it down, I remember when I was in England visiting Jonah's parents, who are our children, and our daughter-in-law, the Secretary of Health went on television in November and said, we're out of money. No more elective medicine till January. This is to Great Britain. Well, we don't have that attitude here. And somewhere in between is probably the right thing. So what you're asking about is very relevant, and it is a policy issue, just like educating people not to smoke is a policy issue. We should have freedom to smoke cigarettes. If it causes a third of all cancer deaths, is that a freedom we want to say is going to be unencumbered or not? And there's a law that's still not probably going to be passed that we won't be allowed to smoke in public places in Texas. It's been passed in Houston, as you know. But there are people that say, I want my freedom. So these are huge public policy issues that involve medicine and healthcare. And I'm excited about an opportunity to work on them.
Thank you very much.
Thank you, John.
Good.
Thank you, Barry.
Great.